Hi guys, 5 marks very important questions in pathophysiology, and also I will upload a very important textbook for your examination. Okay, in these questions what I am giving now, every question will be cleared in that textbook. I will upload in the description, you just go through that, and I have discussed from this previous year question paper, and also these questions which was framed those were on the basis of the knowledge of the most perfect supervisors and also question papers. Clear? The first question is what are the vascular cellular events in acute inflammation? See, very simple question. This question fixed for your examination. Various cellular events. Here first you have to write, define that. Then inflammation you have to write, what is this inflammation, types of the inflammation like acute and chronic, then cellular mediators and chemical mediators. Okay, these a pattern we should follow. If you follow this pattern means definitely from 5 you will get 4 to 3 marks. Okay, it's simple. Next, write mechanism involved in the pathogenesis of the cell injury. What mechanism is involved? First you have to write what is this cell injury. After writing the cell injury, you write the types in that cell injury. I will tell you. See, cell injury, causes, then mechanism. Mechanism here is like mitochondria damage, cell wall damage, nucleus damage. You have to write about this one. Where if they ask about in the cell injury, mechanism of cell injury, pathogenesis means you know that pathogenesis of cell injury, irreversible or either a reversible cell injury. You can write anyone from this. Then third one, explain pathogenesis, clinical presentation of the gout. Very simple. First try to write what is this gout. Then you write the, if types is present, write the types, causes, symptoms. Then go for the pathogenesis. If they ask for 10 marks means then you have to write the complications and risk factors. Same for every question. Then pathogenesis of the acute renal failure. Same, you write what is this renal failure, chronic and acute, two types are there. Then you write the causes, explain the symptoms, complications, then also at last you have to say the pathogenesis. Pathogenesis and pathophysiology both are same. Then explain pathogenesis of the syphilis, and also I will tell you how to remember the symptoms and causes at last, so be with me at last. Same, syphilis, you know that it is a sexually transmitted disease, write about that. Then explain etiology, pathogenesis, signs and symptoms of typhoid, very important one. Here see, etiology is known as a causes, here both are same. Write the signs and symptoms and also pathogenesis of this typhoid. And also this bacteria typhoid is come from which bacteria? Salmonella typhi, causative organism. Define myocardial infraction, briefly about the morphology of infraction. See, myocardial infraction is the same as the atherosclerosis. They are having very little difference in between them. Most of the content like signs, symptoms, causes are same here. Myocardial infraction, then heart ischemia or stroke, not brain stroke, heart stroke, they are having related here. Then explain inflammatory bowel disease. Write this inflammatory bowel disease, what is this basic. Then you have to explain some of the types, causes, symptoms. Then mechanism of a free radical induced cell injury. Very simple. What are these free radical means? Here you have to write what are these free radicals, and you go on explaining like hydrogen peroxide free radical, superoxide free radical. Okay, if these free radical deposited in your cell, if the deposition is increases, that leads to your cell damage, that leads to the cell injury. This content you have to explain in your free radical induced cell injury. First you write what is this cell injury. Okay, then you write two types, reversible, irreversible, explain those radicals. Then explain pathogenesis of the tuberculosis, very simple, same what I have told in the previous one, you have to follow here that one. And the answer for all these questions where you will get the down in this description, I will upload one textbook. That textbook is a Nirali publication. There you will get every answer for the particular question. Mention sexual transmitted disease, explain pathogenesis of the AIDS. Simple, we have to write what is this STD and pathogenesis of the AIDS. AIDS, syphilis, gonorrhea. From these three, one is fixed for your examination for 5 marks. Clear? Yeah. Then what is a cerebrovascular disease? Explain pathogenesis of a stroke. Cerebrovascular disease means these are the brain disorders, and you have to explain here what are those, and you have to explain the stroke, brain stroke basically. Okay, due to the loss of oxygen or loss of blood to the brain cell, that leads to the stroke. Explain the pathogenesis, it's over. Then what is healing by secondary intention? Very important this one, healing by secondary intention or healing by primary intention. From these two, one is fixed for your examination, or they will just give what is healing, just explain two types. You have to write what is this healing, then second primary and secondary intention. Define ischemic heart disease, mention the types, explain the risk factors. Very simple, what is this IHD, ischemic heart disease, types and risk factors. I have told you ischemic heart disease, atherosclerosis, okay, myocardial infarction, these all resembles very closely to each other. If you remember anyone here, means you can write all these three. Define metastasis, briefly discuss the roots of metastasis. It is also very important. Metastasis comes under the cancer. Go through that. Here this question is fixed for your examination for 5 marks. Then next is define viral hepatitis, classify them, write a note on pathogenesis of hepatitis B. See, first you write what is this viral hepatitis, then you have to write some of the classification like hepatitis A, hepatitis B, C, D, E, F, G. Okay, many are there, but you stop for A, B, C, D. Write one line about that, and they ask here, write symptoms, patho causes. If they ask also you write, if they won't ask also you write here. Which one? Causes, symptoms. See, basically what they will ask, they will just ask, see, explain pathogenesis of leprosy. If you write directly pathogenesis, means you will fail in the examination. You have to try one more attempt. You write your causes, symptoms, then go for pathogenesis. Explain the process of healing by primary intention. See, next question is our primary intention. First they asked secondary intention, now they are asking the primary intention. Primary intention, secondary intention, secondary intention, you have to go through this. Define schizophrenia, mention the positive and negative symptoms of the schizophrenia. Very important, there they have asked in 10 marks Alzheimer or any Parkinsonism. Here they will ask schizophrenia. Just you write what is the schizophrenia, and you have to write the symptoms, positive and negative symptoms, and also causes. If and pathogenesis is also very important here. List out chemical mediators and their role in the process of inflammation. First you write what are these inflammation, types of inflammation, chemical mediators. Very important, chemical mediators. What are the chemical mediators? Which chemicals will cause the such type of the inflammation? Explain the development of alcoholic liver disease. Yes, very important one. See, here they have asked the question development, but you have to write what is this alcoholic liver disease. Development is nothing but pathogenesis now. You write that, then you write symptoms, causes, explain the pathogenesis. Explain pathogenesis and clinical representation of rheumatoid arthritis. Very important one. Gout or rheumatoid arthritis. From these two, one is fixed for your examination. Here also same, you have to write causes, symptoms, definition, and pathogenesis. Etiology, pathogenesis, and morphology of reversible cell injury or irreversible. See, this actually I want to discuss in 10 marks, but here I have discussed. Here you have to write the reversible and irreversible. From these two, one is fixed for your examination. Clear? Then I want to tell you how to write the symptoms. See, for all the diseases, the symptoms are same. Maximum they are having nausea, vomiting, diarrhea. You practice this one. Nausea, vomiting, diarrhea. Nausea, vomiting, diarrhea. Okay, start.